Pune University, Department of Health Sciences, I extend a warm welcome to the trustees of Dr. Suparna Bagchi Memorial Trust, all the eminent scientists, faculty members, alumni, and students who have gathered here today. We are here today for the launch of Dr. Suparna Bagchi Ph.D. Fellowship, followed by the N.S. Deodhar Memorial Oration 2024. We will begin the program with a quick introduction about the Department of Health Sciences by the head of the department, Dr. Abhay Kudare.
Honorable Pro-VC sir and all respected dignitaries present today. At the School of Health Sciences, we have completed now 3 decades, 30 years of successfully running an MSc program in Health Sciences that started as an MSc Health Sciences program in 1994. Moreover, this year we will complete 20 years of successfully running Masters in Public Health program. So in the next week, the 30th batch of students of MSc Health Sciences and 20th batch of students of Masters in Public Health will start their academic journey from this department. Going beyond teaching programs, we continue our rich legacy of research endeavors. During COVID-19, we successfully completed the Seroprevalence Survey in collaboration with the Pune Municipal Corporation and ISA Pune. From this department, under the Center for Complementary and Integrative Health, we have initiated, mentored and guided several vaccine adjuvant trials in various parts of India. After the COVID-19 pandemic also, in collaboration with the State Health Systems Resource Center under the National Health Mission, the Government of Maharashtra, we have completed a study on the impact of COVID-19 on the mental health of school children and adolescents. From last December to almost March of this year, we were doing a situational analysis study with the State Health System Resource Center to document current needs, challenges and way forward for the ASHA workers, that is accredited social health activists in Maharashtra, who are considered as the backbone of our public health services. And for this study, we have worked in 8 districts of Maharashtra. All our research undertakings are student-centric and student-driven, whereby students get real-time exposure and experiences working with our public health systems. We are envisaging to initiate proceedings for integrated Masters and PhD programs at the department in the coming year or so. Today's launch program of Dr. Suparna Bagchi PhD Fellowship will be a concrete step in this desired direction, and of course, well integrated with the National Education Policy Framework of 2020. With this brief introduction to the department, I will take this opportunity to thank the university leadership for supporting us in this 3-decade-long journey. Thank you, Professor Sir, and thank you to all the dignitaries present here.
Thank you, Abhay sir. Dr. Suparna Bagchi, an alumnus of this school, will always be remembered by many of us who knew her, not only for her academic brilliance, but also the warmth and generosity of spirit that she always exuded. I request her mentor and senior faculty, Professor Anita Kar, who shared a close bond with Dr. Suparna, to talk about her journey from School of Health Sciences to health scientist at Center for Disease Control and Prevention, Atlanta, USA.
Is it possible to have my slides? Is it possible? That it will be very nice. You just take care. I have the slides on stick right now. Yeah.
Dr. Suparna Bagchi, a brilliant alumnus of Pune University, joined the School of Health Sciences in 1999 and graduated with master's degree in health sciences in 2001. She was an outstanding student, not only because of her academic brilliance, but by the fact that she was driven. She had a steadfast determination to carve out a career path for herself in the field of public health, inspired by her grandfather, who was a professor of community medicine, if I'm not mistaken, in Lucknow. Suparna wanted more than what the School of Health Sciences curriculum at that time offered. This was in 2000, when public health was confined within medical colleges. It was only in 2004 that this school received the first UGC-supported MPH program that opened up public health to students from a non-medical background. But coming back, that when Suparna decided that what she was looking for was not available in India, she resolved to look abroad for education in public health. And at that time, I remember referring her to no other than Dr. N.S. Devdar, a giant in the field of public health, a teacher of teachers, and someone who didn't suffer fools easily. When you interacted with Dr. Devdar, you had to be mentally on the tip of your toes. It was with such a giant that Suparna left an indelible mark, to such an extent that he would inquire about her progression in the field of public health. It was a great matter of pride with us that she was the first student from the School of Health Sciences to go abroad for a master's and a PhD in public health. Before that, we had a number of students who had gone ahead to do a PhD, but they had done this PhD in life sciences. It was easier to get a support for that. So Suparna was our first student who went in, and in 2003 she completed her second master's in public health sciences from the University of Alabama in Birmingham. And subsequently, she was our first student to get a DRPH degree in 2009. Her doctoral studies was on disordered eating behaviors among adolescents, and this qualified her to work in behavioral risk factor surveillance and the youth risk behavior surveillance system in Georgia State Health Services. Subsequently, Suparna went on to complete the very prestigious Epidemic Intelligence Fellowship from CDC, and then subsequently never looked back into career in infectious disease epidemiology. She was both involved in not only investigating the Ebola outbreak in Congo, but also she was very, very integral, as you will see, in the COVID-19 pandemic in the US. If I may have the next slide, please. Dr. Indranil Roy, who's a public health specialist and advisor at CDC India, he says that Suparna's contributions in epidemiology and infection control are widely acknowledged within and beyond CDC. Her academic achievements, including her work on infections in hemodialysis patients and nursing home patients, remote infection prevention strategies, the presence of SARS-CoV-2 in the United States, and the effectiveness of COVID-19 vaccines, which have garnered over 500 citations, are a testament to her contribution to science and research. Her dear friend, Dr. Janita Bell, MD, medical officer at the CDC, remembers that Suparna dedicated her professional career to the pursuit of knowledge so that her work could impact the health and well-being of underserved populations. Janita remembers her expertise, Suparna's expertise in disease surveillance and in identifying the usefulness of these data sources to guide public health programs in testament. This is evident in her final publication, which she co-authored, and her study determined the risk of blood system infections in patients undergoing dialysis in the USA. In the US, about 500,000 patients annually undergo dialysis, and they have established a monitoring system to check how many of these patients develop blood system infections and why. And the contribution of this last paper that Suparna authored was that they estimated that for 10 patient months of dialysis, there would be about 3 cases of blood system infections. This is just a small example of the utility of the field of epidemiology that was so close to Suparna's heart. A testament of her value to the institution comes from Dr. Rochelle Walensky, former director of CDC, who records Suparna as a highly respected professional who brought extraordinary dedication to the surveillance branch of the Division of Healthcare Quality Promotion. Dr. Walensky mentions that her work in the coronavirus disease 2019 response was of particular importance to the agency and its mission. She goes on to mention that Suparna's legacy will continue through those she mentored, guided, and inspired during her distinguished career. One of the mentees was Dr. Francis Anor from the Division of Violence Prevention, National Center for Injury Prevention and Control, CDC. Dr. Anor says that as a friend, I am forever grateful for her extraordinary supervision and mentorship. Her legacy will continue to live on, and the gift of mentorship she provided is a gift that will keep living through me and others she mentored. Suparna's heart was in training epidemiologists like her. As Dr. Ashutosh Wadhwa, Global Program Advisor, National Center for Emerging and Zoonotic Infectious Diseases, CDC USA recalls, I was astounded by her clarity on public health principles and epidemiology. We frequently discuss the importance of training for budding public health professionals. I am delighted that the scholarship is being established in Dr. Bagchi's name. I hope that future students will continue her legacy and contribute significantly to the field of public health. In these words from her colleagues comes the essence of Dr. Suparna Bagchi Ph.D. Fellowship. The fellowship should have, we intend, those qualities that made up Suparna. For those who are aspirants of this fellowship, which we will launch very shortly, if you find your data is a comfortable 1,000 people in a nearby hospital, Suparna would have asked you the question, have you picked up a random sample? If your study is going to be in the comfortable environments of urban slums, Suparna would have asked you, are these truly the population, the underserved population? With these words, I hand you over to Mr. Bagchi to please continue.
Respected OBC Sir Dr. Parag Karakar, pardon me if I got the name wrong. Professor R.K. Mudadkar, Professor Bhushan Patwardhan, Dr. Shekhar Mande, Dr. Anita Kar, and many other distinguished ladies and gentlemen. Today is 24th July, her birthday. It's a mixed feeling here. First of all, we are missing her today. But all of us are here for this occasion for the launch of the fellowship. So it is a great day to remember. If not celebration as such, it is a great day to remember. Dr. Kar has already traced her career from this place up to CDC, and then we are following presentation by Dr. Janita Bell, who will also do the same thing. So I am not going further in that, but I will only dwell on what happened after she left for the heavenly abode. That was June 4, 2022. As usual, we were in a foreign country, but we did not know how to handle the situation. Fortunately, our friends and some of my relatives were there to help me to go through the initial formalities after what happens there, funeral and everything, and then to take care of her estate responsibilities, so all that, and the execution of the will and all that. And after 1 month, we had to leave because we could not stay there indefinitely. And there was no role for us. The will was to be executed by the appointed executor, who was one of her great friends. Then we came here, and it took another few months for us to absorb what has happened. She was our only child. We didn't have anything else to do. So there was a great vacuum. A few months, then we thought that her legacy has to continue. And what else other than public health? So at that point of time, our only point of contact was Dr. Anita Kar. So we contacted her, and then she got us introduced to Dr. R.I. Kudale, and then we got into thinking about this, instituting this fellowship, and it took us about more than 1 year to go through all those formalities, registrations and all that, and I'm happy that it is being launched today. So her legacy, I hope, will continue. It is a very small way that as an individual I can contribute towards public health in India. We cannot do anything in USA because we cannot be not citizens there. So only in India, and this is the only place where we can start doing something. So that is how we thought about it, and today is coming into launching is going to take place very soon, and it's a great completion of our dream, and I hope this will continue for a few more years. The whole thing started, if I may trace it before, it started with my father, who was a public health professional. Being a medical graduate, he chose public health over more lucrative fields like medicine, surgery and all those things. He went to Johns Hopkins University in 1962 for MPH. After that he came and he was professor of PSM, Preventive and Social Medicine at Lucknow, and retired from Allahabad Medical College. So somewhere I was, astounded the day Suparna decided public health as her career. So then she told me the culprit was my father. There was no other way. I had to give in, no problem. But then she has done it to the best possible. She wrote to the best possible highest doctoral and postdoctoral EIS, as Dr. Kaur has mentioned. That is a very distinguished fellowship. And she not only did that, she mentored so many people in doing that. Francis is one of them. And that is how, and it is not, later on after death we realized how far she was good as a interpersonal relationship rather than just a professional. And she interacted with their family and mentored them like young brothers and sisters. That was very important. But somehow the fate had a different story, and her work has remained unfinished, which I hope those who we are going to sponsor and the new generation of the research scholars and who will come out of this university will be able to continue. And public health has to develop in India definitely, even if there is budget allocation is not very attractive. It has been less than 2% for the last 10 years, if I'm not wrong. But it needs to be done. And we realized it more after the COVID-19. We know how important it is. And somebody has got to, it's not somebody, so many people have got to take it further. A lot of work is to be done. We have started in a very small way, and the place where we live, Kamshe, there is a primary health center, and there we found that they are needing very small basic things like blood pressure monitor and some medicine and syringes and all those. They say they wanted donations. We readily donated something, and this is a very small way. We are not the medical professionals, but we can only help in this way. So that is a very small way we are trying to do this. That's the best we can do. And another thing I would like to say is when we entered this morning, posters. It was difficult to hold my tears for half an hour. So it's getting difficult for me to speak anymore. But thank you very much to the Department of Health Sciences who have helped us to realize this dream so far, and I hope it will continue in due course of time. And I find myself in the august company of so many health professionals, and it's a great day to celebrate her birthday. Not celebrate, rather remember her birthday. Thank you for arranging this function today itself, 24th July. Thank you once again.
to everyone all present here. I think the students realize I'm very emotional. So therefore, it becomes a very difficult situation to go on. I remember coming here with Suparna off and on when she was studying here, and also trying to find out what she was actually wanting to do. At that time, she was just a mere student out of Garwari College who had done microbiology. So therefore, we did not know. She got admission to Bharti Vidyapith Medical College, and she spoke to the counselors that, thank you sir, I know I got my admission, but I don't want to do it. I will go into public health. For me, public health was a blank place where I used to hear my mother-in-law telling my father-in-law, you did not practice medicine, so we don't have money. Right, so that was what we used to hear. So I used to tell her, this is what your grandmother said, so are you also leading to the same path? So she said, I don't know. But one thing I made it clear, being a teacher all along, I made it clear that whatever qualifications you develop, please go on studying till the end of it. Because there must not be a situation where somebody will tell you that you are not qualified for that position. Right? You should be able to stand out among people. That is most important. And the focus is not money. The focus is what you are trying to do. Off and on during her life, I spent a lot of time, because I don't know how many of you know, that from 2013 she got breast cancer. And she has fought cancer for 9 years. And she succumbed to it on 4th June 2022. So off and on I used to ask her, because I used to meet her colleagues when we used to visit US, be there for 6 months at a time. And I used to say, what do you do on the computer all the time talking to people? I don't understand. So then she told me, you don't know how far reaching this program is and how much has to be done. I remember once visiting Arunachal Pradesh, I was talking to Dr. Kaur. I met a doctor from Pune who was arranging for street plays over there with the local people, going into the villages to talk about, to sing and dance and tell the common people, the local people, go to primary health centers, don't go to Godmen and the Ochas. Right? When I told Suparna, she said, I'm coming back to India to do that only. Doesn't matter if I don't get a job, I'll do it myself. But maybe God had some other plans. So one of the few things when I used to discuss with her, she was already in CDC, she knew what CDC India was doing. And therefore she often spoke to me about man health. Man health, she had explained to me that humans, animals and the ecosystem together are responsible for various diseases. And therefore, all three need to be worked on together. So, CDC Indranil told me, ma'am, you could speak about that, remind people that human problems, diseases, comes from animals, wild and domesticated, and the ecosystem. So therefore, all the three needs to be linked together to actually work in public health. Secondly, she told me, because I saw her mental health condition when she was ill. And she used to fight about that because she had to face patients, she had to go to the hospital, she was going in USA, she was going into the interiors. So I used to ask her, how do you get the courage?
She said, if I am not strong in mental health, how can I promote mental health to the people? Even in our country, if somebody falls ill, they are now put away. Whether it is leukemia, whether it is any disease, even cancer. People think there are no treatments for it, and therefore they are ostracized from the society. And the mental health of the patient as well as the family suffers. So therefore, mental health is another area which needs to be worked on. So my suggestion is very little. I am not doing anything, right? But I would suggest to one and all that when you are working with your mentors, remember these things, that first of all you need to be mentally strong. Second is you must have a role to play in the society, and no role is small. Every little thing that you do for another person is just as important. If you see, through chemotherapy, through radiation, through surgeries, she worked. Nothing stopped her. She expired on 4th June, but she was at her computer till 30th of May. From the ICU in the hospital in Emory Medical Center, she was working, and her doctor and all the nurses were surprised that she had the energy to work. So I would suggest to youngsters, don't get your focus anywhere else. Focus on whatever you intend to do in life and keep going. And just as my husband said that the government's the policy on public health seems to be very low, I would suggest the university and the department work on it, that public health professionals get the same status as medical practitioners in our society. Right? Because they are doing much more work. You are actually going to the common people. You know more about it. So therefore the government has to accept it, and I think it is the department and the university who need to focus on it. So I know I didn't want it to be a big short lecture, but I just wanted you to know what Suparna wanted to do, so that you could carry out. What we can do is, we have started in a small way with one student. Maybe if the department tells us after 2 years that it is going on, we can also pass it on maybe 2 or 3 students. Right? So therefore, I hope that your work in public health will continue. Thank you very much.
Bagchi sir and ma'am, on behalf of the faculty and students of health sciences, I would like to share that we are truly humbled and touched by your courage and kindness. Thank you very much. I request Honorable Provost sir to felicitate Bagchi sir and madam.
Hello everyone, my name is Janita Beth.
will now share a video recording of Dr. Suparna's work during the COVID-19 pandemic, which was shared by my colleagues at CDC Atlanta.
Hello everyone, my name is Janita Bell, and I'm a physician who works at the U.S. Centers for Disease Control and Prevention, where I met Suparna. It's my pleasure and honor to present a tribute to my dear friend and colleague Suparna. And before I proceed, I would like to first give thanks to Mr. and Mrs. Bagchi, who suffered greatly with the loss of their beloved daughter, but have also shown exceptional fortitude in pursuing a memorial and fellowship in Suparna's honor. Thank you both for inviting me to speak at such a momentous occasion. Suparna was a well-accomplished woman, but you wouldn't know it because of her humility. Despite her humility, Suparna was a decisive and determined individual. Early in her academic career, she decided that a career in public health would be her path to change the world. And with that decision, Suparna stayed on the straight and narrow path to earning 4 degrees from 1999 to 2009. These achievements set the stage for Suparna to elevate her impact on a national level. After she earned her doctorate degree in public health at the University of Alabama at Birmingham, she became a staff member at the Georgia State Department of Health. In this position, Suparna conducted research to elucidate the trends in chronic disease, violence, and youth-related substance abuse to identify targets for intervention. She shortly thereafter joined CDC's Epidemic Intelligence Service, or the EIS program, as a fellow, and shifted her focus to include the prevention of infectious diseases at the CDC assigning to the Kansas and Texas State Departments of Health. She became an expert at evaluating public health surveillance systems and identifying the usefulness of these data to guide public health programs. However, Suparna's most impactful work occurred after she returned to CDC headquarters as an epidemiologist in the Division of Healthcare Quality Promotion. There, she supported the agency's response to the Ebola epidemic in Africa's Democratic Republic of the Congo and the COVID-19 pandemic. Importantly, Suparna helped lead the management and growth of the first national surveillance system used to monitor the virus causing COVID-19 among nursing home populations where the nation's elders commonly reside. Suparna was very impactful and able to accomplish many things while she led the CDC. She authored over 15 publications in scientific journals. She gave more than 30 oral presentations at scientific conferences and meetings. She deployed on at least 4 occasions to fulfill CDC emergency response positions. One was the Ebola epidemic in the Democratic Republic of the Congo, and the other COVID-19 pandemic in the United States. She developed CDC's methodology to validate healthcare-associated infection surveillance data, which created a model that we even use to this day. And she and I co-led the development of the post-acute care program during the COVID-19 pandemic for the Division of Healthcare Quality Promotion. Suparna continued to have impact even to this day. With the work that we did together in leading the post-acute care program, we were able to enroll over 15,600 nursing homes into our COVID-19 surveillance system, and they continue to report into this day. And they're the largest cohort of healthcare facilities that report into the nation's surveillance system. These data were used to estimate the effectiveness of the COVID-19 vaccines in nursing home populations, but also the effectiveness of the vaccine in dialysis populations. The data helped the government deliver supplies to nursing homes that had experienced severe shortages in personal protective equipment like masks and gowns and gloves. Suparna even convened her colleagues and other scientists in our division to develop a national infection data concerning hemodialysis patients. And we were recently able to summarize those findings and publish them online. Although my time with Suparna was relatively short, I learned that she was an even more impressive person outside of work. No matter how grand her aspirations and ambitions were for public health, she never pursued them at the expense of enjoying life. Suparna loved the company of family and friends, and she enjoyed being one of the best hosts I have ever known. She even became a sommelier and even hosted parties for elders in her community. Suparna and I, we met in 2016 after I joined the department where she worked, but we were bonded together during the COVID-19 pandemic. She and I supported one another during the toughest times of our lives, while we were simultaneously innovating and developing national solutions to help save millions of lives threatened by COVID-19. This came with a lot of trial and tribulation as we led a team of over 40 people through the process. Regardless, I am so blessed to have done it with Suparna. I had the pleasure to continue her legacy and the team we developed. We continue on. I found her to be a terrific friend, colleague, mentor, leader, motivator, and innovator. And all she did, she was compassionate, strong, ambitious, and resilient. As I conclude my remarks, I want to share one of my favorite pictures of Suparna. And in the photo, Suparna and I are accompanied by our mothers. It was one of the last times I saw her enjoying great food and being in the company of loved ones. So with this image in mind, I'm so proud to see that Suparna's dream lives on with the support of Pew University. I charge every student at Pew University to be inspired by Suparna's story. Dream big, be persistent and resilient, but most of all, enjoy life and surround yourself with loving and caring people. Thank you all.
I now invite Professor Bhushan Patwardhan to be on the stage with the dignitaries, and we will proceed to the release of the flyer. I request Pro EC sir to release the flyer of Dr. Suparna Bagchi, Ph.D. Fellowship. I now request Pro EC sir to say a few words.
Very good morning. Dignitaries on the dais, Dr. Shekhar Pandit sir, Dr. Bhushan Patwardhan sir, Mr. Subir and Mrs. Susmita Bagchi Madam, Head of the Department of Health Science, Dr. Bagchi sir, Suparna's mentor, Dr. Anita Madam, Pillu sir, all the distinguished scientists who are present here to release launch of this fellowship program at Health Science Department. I'm very humbled that the setback, the parents, and even have teachers with the instance that COVID pandemic has shaken the world of many of us, and still we are recovering. All systems and processes need to be reviewed again and again. And when we are talking about India as a country of 140 plus crore human population, public health has got a significant role to play in the future. Today also we are finding ourselves in there's a lot of dengue fever instances happen. Many of the hospitals has 30% plus beds are occupied only with the dengue. And so many people are calling for some other kind of support. I'm very thankful to Mr. and Mrs. Bagchi that the legacy of Suparna will be taken ahead with this kind of research fellowship. And definitely we need to find out some landmark research outcome which definitely contribute for the public health. It's not another option that public health generic thing where those students do not go for any other thing, go for public health. It's very important that we all realize. So I wish that the memory of Dr. Suparna will be more visible after some good research will come out after this fellowship. And definitely with the support of the teachers in the department, the head of the department, and our mentors like Dr. Bhushan Patwardhan, sir, will definitely come out with some very good research outcome which will definitely help this nation and the people to contribute something to the people's health in the future. So I wish that with the noble and humble thought you have started with fellowship will definitely grow somewhere and will have some good outcome, research outcome will definitely help. What dream of Dr. Suparna is incomplete. I think we will try to see that as a department with the support of the teachers and our students will try to take it ahead and try to fulfill some part of it. So I am thankful to all the parents for coming here and all the dignitaries for coming here, and the students also. See how it happened when we work, we do not realize, but I think the sentiment with these fellowships are more important. So I think those who are really going to use this should carry this sentiment for doing more deeper research and contribute something to the public health of this kind. Thank you very much.
Thank you, sir.